What is food poisoning? Food poisoning is an illness caused by the consumption of contaminated food or beverages. Contaminants include bacteria, viruses, parasites, toxins, or chemicals. Symptoms range from mild gastrointestinal discomfort to more severe conditions. Common symptoms of food poisoning: A. Nausea, unpleasant sensation in the stomach, often preceding vomiting. May be accompanied by a general feeling of discomfort. B. Vomiting, forceful expulsion of stomach contents through the mouth. A common reaction to the body trying to rid itself of harmful substances. C. Diarrhea, increased frequency of loose or liquid bowel movements. Can contribute to dehydration if not managed. D. Abdominal pain, discomfort or cramping in the stomach or abdominal region. May vary in intensity and duration. E. Fever, elevated body temperature, often a sign of the body's immune response. May accompany other symptoms and indicate a more severe infection. 2. Onset of symptoms after consuming contaminated food. A. Time frame symptoms typically appear within a few hours to a few days after consuming contaminated food. The onset time varies based on the type of pathogen involved. B. Rapid onset. Some pathogens, like Staphylococcus aureus, can cause symptoms within a few hours of consuming contaminated food. C. Delayed onset. Other pathogens, such as Salmonella or E. coli, may have a delayed onset, with symptoms appearing 1 to 3 days after exposure. D. Duration of symptoms. The duration of symptoms can vary, but often lasts from a few days to a week. Severity and duration may depend on the individual's health and the types of food poisoning. Food poisoning can result from various contaminants, including bacteria, viruses, parasites, toxins, and chemicals. Here are some common types of food poisoning along with their causative agents. 1. Bacterial infections. Salmonellosis, caused by Salmonella. Bacteria, often found in raw or undercooked eggs, poultry, and unpasteurized milk. E. coli. Infection, Escherichia coli. Some strains of E. coli can cause food poisoning, commonly associated with undercooked beef, raw vegetables, and contaminated water. Campylobacteriosis, caused by Campylobacter bacteria, found in raw or undercooked poultry, unpasteurized milk, and untreated water. 2. Viral infections. Norovirus infection, highly contagious and often associated with contaminated water, ready-to-eat foods, and person-to-person transmission. Rotavirus infection, common in infants and young children, often transmitted through contaminated food, water, or surfaces. 3. Parasitic infections. Giardiasis, caused by the Giardia parasite, commonly found in contaminated water and food. Cryptosporidiosis, caused by the Cryptosporidium parasite, often transmitted through contaminated water, fruits, and vegetables. 4. Toxin-mediated food poisoning. Botulism, caused by the Clostridium botulinum bacterium, usually associated with improperly canned or preserved foods. Staphylococcal food poisoning, caused by Staphylococcus aureus bacteria, often associated with contaminated dairy products, salads, and sandwiches. 5. Chemical contamination. Mushroom poisoning. Consumption of toxic mushrooms can cause severe illness or death. Heavy metal poisoning. Contamination with lead, mercury, or other heavy metals can occur in certain types of fish or through contaminated water. 6. Allergenic reactions. While not always classified as food poisoning, allergic reactions to certain foods can lead to severe symptoms and require immediate medical attention. It's important to note that the symptoms and severity of food poisoning can vary depending on the type of contaminant and the individual's health. Seeking medical attention is crucial for a proper diagnosis and treatment. Home remedies for food poisoning. While seeking medical attention is important for severe cases of food poisoning, Mild cases may be managed with some home remedies. These remedies can help alleviate symptoms and promote recovery. However, it's essential to consult with a healthcare professional if symptoms persist or worsen. Here are some home remedies for mild cases of food poisoning. 1. Hydration. Drink plenty of fluids, such as water, clear broths, or oral rehydration solutions. Replenish electrolytes lost through vomiting and diarrhea. 2. Rest. Allow your body to rest to help with the healing process. Avoid strenuous activities that may worsen symptoms. 3. Bland foods. Gradually introduce bland, easily digestible foods as your symptoms improve. Examples include plain rice, bananas, applesauce, and toast. Brat diet. 4. Ginger. Ginger can help relieve nausea and vomiting. Try ginger tea, ginger ale, or chewing on a small piece of fresh ginger. 5. Peppermint. Peppermint may help soothe an upset stomach. Peppermint tea or peppermint oil in water, in small amounts, can be beneficial. 6. Activated charcoal. Activated charcoal may help absorb toxins and reduce symptoms. Consult with a healthcare professional before using, as it may interact with medications. 7. Probiotics. Probiotics can promote the growth of beneficial bacteria in the gut. Consuming yogurt with live cultures or probiotic supplements may aid in recovery. 8. Brat diet. Stick to the brat diet: bananas, rice, applesauce, toast. Initially, as these foods are easy on the digestive system. 9. Avoid irritants. Avoid spicy, fatty, or dairy-rich foods until your stomach has settled. Stay away from caffeine and alcohol, as they can contribute to dehydration. 10. Herbal teas. Chamomile and peppermint teas can have soothing effects on the digestive system. Important note: if symptoms persist, worsen, or if there are signs of dehydration, such as dizziness, dark urine, or rapid heartbeat, seek prompt medical attention. Severe cases of food poisoning may require medical intervention, including antibiotics for bacterial infections. Home remedies are supportive measures and should not replace professional medical advice and treatment. Medical treatment for food poisoning. Medical treatment for food poisoning is primarily aimed at managing symptoms, preventing complications, and addressing the underlying cause of the illness. It's important to seek professional medical advice for a proper diagnosis and appropriate treatment. The specific medical interventions may vary based on the type and severity of food poisoning. Here are some common medical treatments. 1. Fluid replacement, intravenous, IV. Fluids may be administered to treat dehydration caused by vomiting and diarrhea. Electrolyte solutions help restore the balance of essential minerals in the body. 2. Antiemetic medications. Medications to control nausea and vomiting may be prescribed, especially if symptoms are severe and persistent. 3. Antidiarrheal medications. In some cases, antidiarrheal medications may be recommended to alleviate diarrhea. However, these are generally not advised for certain types of infections, such as those caused by certain bacteria or parasites. 4. Antibiotics. If the food poisoning is caused by bacteria, e.g., Salmonella, E. coli, antibiotics may be prescribed. Antibiotics are not effective against viral or toxin-mediated food poisoning. 5. Antiparasitic medications. Parasitic infections may require specific antiparasitic medications to target and eliminate the parasites. 6. Hospitalization. Severe cases of food poisoning may require hospitalization, especially if dehydration is significant or if complications arise. Intravenous fluids and other supportive care can be provided in a hospital setting. 7. Testing and diagnosis. Laboratory tests, such as stool cultures, may be conducted to identify the causative agent of the food poisoning. This helps determine the most appropriate course of treatment. 8. Pain management. Pain relievers may be recommended to alleviate abdominal pain or discomfort. However, certain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, may be avoided in some cases due to the risk of gastrointestinal irritation. It's crucial to follow the healthcare professional's advice and take any prescribed medications as directed. Additionally, individuals with severe symptoms, compromised immune systems, or underlying health conditions should seek prompt medical attention. Self-medication and the use of antibiotics without proper medical guidance are strongly discouraged, as inappropriate use can contribute to antibiotic resistance and may not be effective against certain types of food poisoning. Prevention. Tips 1. Safe food. Handling and preparation. Wash hands. Thoroughly. Wash hands with soap and water before handling food, after using the restroom, and after touching raw meat, poultry, or eggs. Separate raw and cooked foods. Use separate cutting boards and utensils for raw and cooked foods to prevent cross-contamination. Avoid cross-contamination. Store raw meat, poultry, and seafood separately from other foods in the refrigerator. Use different utensils and cutting boards for raw and cooked foods. Thoroughly. Wash produce. Rinse fruits and vegetables under running water before consumption or cooking. 2. Proper cooking temperatures. Use a food thermometer. Ensure that foods, especially meat, poultry, and seafood, are cooked to their recommended internal temperatures. Check the temperatures using a food thermometer to avoid undercooking. Cook ground meat thoroughly. Ground meat should be cooked to an internal temperature of at least 160 degree, 71 degree ice. Poultry and seafood. Cook poultry to an internal temperature of 165 degree, 74 degrees C, and seafood to at least 145 degree, 63 degrees C. 3. Food storage guidelines. Refrigerate. Promptly, refrigerate perishable foods within 2 hours of cooking or purchasing. In hot weather, above 90 degree Rav or 32 degrees C, refrigerate within 1 hour. Follow use-by dates. Adhere to expiration dates and use-by dates on food packaging. Store leftovers. Safely, refrigerate leftovers promptly and consume within a safe time frame. 4. Hand hygiene. Wash hands. Frequently, wash hands thoroughly with soap and water for at least 20 seconds, especially before handling food, after using the restroom, and after touching raw foods. Use hand sanitizer. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Glove use. If gloves are used, change them regularly. And remember that gloves do not replace proper hand hygiene. These prevention tips are essential to avoid food poisoning. Following these practices helps reduce the risk of contamination, ensures proper food handling, and promotes overall food safety in the kitchen.